I've recently seen a large group of people self-diagnosing themselves whether they have androgenetic alopecia, female pattern baldness, or telogen effluvium, and it seems like a lot of people are using these terms interchangeably online. I don't think a lot of people know what these terminologies mean and that these are not the same thing. Androgenetic alopecia is not the same thing as female pattern baldness, and it is not the same thing as telogen effluvium. So in today's video, I'm going to be explaining to you exactly what these terms are, what these conditions are, and the reasons that they occur so that you are not self-diagnosing yourself and you are rather going to get tested with all of the things that I'll be mentioning in this video. So let's get started. I'm going to be starting off with female pattern baldness first. I'm going to be talking about the female category first because the male category is self-explanatory. Female pattern baldness looks like this and is basically a reduction in hair density in this area of the head. It all often has to do with females, hence the word female pattern baldness. And females, when they have female pattern baldness, they have a normal serum levels of circulating androgens in their blood, which means that their hair loss is not dependent upon DHT, because androgen is DHT that converts when you are losing hair in other conditions. But in female pattern baldness is when you have regular or normal serum levels of androgens circulating in your blood. Women with female pattern baldness and normal androgens circulating in their blood also do not have symptoms such as irregular periods or hirsutism. Hirsutism is overgrowth of hair in other parts of the body. So this type of baldness has been detected with women who have normal to low androgen receptors and a deficiency of total absence of androgens. So why do we call this female pattern baldness? We call this female pattern baldness because there is no indication of androgens, which is again DHT. Now we're in a different video, we're going to be talking about how to cure this, but in this video I'm only talking about what these terms mean and what these conditions mean. Okay, so if you have hair falling from here in the central frontal part of the head, it could be female pattern baldness. So in this case, what you are going to do is first you're going to go to a doctor and you're going to ask for blood tests. You're going to ask for androgens, testosterone, estrogen, progesterone. You're going to ask to get these hormones tested, and in another requisition, you're going to get a complete iron panel done. This will help us determine what the cause of female pattern baldness could be. Once your tests have come in and you have determined the cause of it, that's when you can go ahead and start your treatment. Next is androgenetic alopecia. Androgenetic alopecia in females look like this. And this is when coin-sized amounts, quarter-sized amounts of hair patches fall out from different areas of the head. So it will look like small quarters, and they will be different parts of the area. Sometimes they're going to be bigger than a quarter size. Sometimes they can be smaller than a quarter size. And sometimes they are a quarter size. 50% of males and 50% of females deal with this. And this is because the androgen receptor activation shortens the anagen phase. The anagen phase is the growth phase of the hair, which causes the follicle to miniaturize, means get smaller in diameter. Over time, when the follicle gets smaller in diameter because of this androgen, which converts into DHT on the scalp, that is when your hair starts to become thinner over time, and then you completely lose it when the follicle becomes very, very tiny. Androgenetic alopecia usually starts after 20s. It progresses in your 30s. So if you are experiencing androgenetic alopecia, obviously after getting tested from your androgens, if your androgens are high, then your doctor can rule out it is because of DHT. Then you can go ahead and start treatment, but obviously start earlier than later in life. If you're 20, 21 years old and you are losing hair, then you want to go and get tested right now, because the earlier you start your intervention and your treatment, over time when it compounds, that treatment compounds, you will have better chances of having a fuller head of hair. Next is alopecia areata. Alopecia areata is also patches of hair falling out from different parts of the head. This is because of an autoimmune response where the immune system attacks itself. So you can see these all conditions have different reasons for happening. When the immune system starts to attack itself, it attacks the hair follicles. Similarly, when you have other autoimmune diseases, for example, I had hypothyroidism, Hashimoto's, my immune system was attacking the thyroid gland. So when the immune system attacks the hair follicles, this causes hair loss from the head and from the face. So from the face, I mean, if a male is experiencing alopecia areata, he will have patches in his beard, round patches, different size patches in his beard or on his body, on his chest. That means that you have alopecia areata. And sometimes it's one episode and sometimes it's on and off. That means sometimes it gets cured on its own without having to do any type of intervention. Sometimes you will experience it once in a lifetime and never again. And sometimes it's an on and off situation. And anything can trigger it and anybody can get it, female or male. So if you have high stress response, if you're going through a breakup, if you're going through a divorce, if you're going through a death situation in the family, anything can trigger it or any food can trigger it. Sometimes there are certain foods that you have an inflammatory response to. It can trigger the alopecia areata. With alopecia areata, there are 3 different kinds, okay? So there is patchy alopecia areata. So just like the word says, patchy means patches of hair loss and big spots of patches in your whole head and on your face or body. And then there's alopecia totalis, which is nearly all of the hair on your scalp. And then there's alopecia universalis, which means no hair on the head, no hair on your face, no eyelashes, no eyebrows on the entire body, no hair. So I have seen some situations and some people deal with this where they don't even have eyelashes or eyebrows. That's alopecia universalis. So the immune system attacks the hair follicles, causing inflammation. The reason I keep repeating this is because that means that when you want to treat it, you have to first treat the autoimmune disease, right? You're not going to go topical and you're not going to just fix it by using minoxidil, right? You're not going to do that. You're going to fix the autoimmune response. You're going to fix the immune system. And for that, I have made a video, the entire immune system protocol. You can go ahead and watch it. It is a very detailed video. The treatment will take anywhere between 5 to 7 years, but 5 to 7 years is anyways going to pass, so might as well start your treatment today instead of wasting further time. The next one is diffuse thinning. This is caused by a disruption in the hair growth cycle where the hair growth enters the telogen effluvium stage. Telogen effluvium can be caused by any reason: traumatic event, death in the family, breakup, divorce, high stress, you just started a business, you have financial problems, surgery, high fever, and usually starts 2 to 4 months after the episode, so after your traumatic event. So let's say you have your traumatic event, you no longer have it, but then after 4 months you start to see telogen effluvium, which is diffuse thinning, hair loss in different parts of the head. It is not patchy, it is uniform hair loss. That is the reason why, because you had that traumatic event like 4 months before. And it can also be caused by a hormonal imbalance, for example, pregnancy, postpartum, PCOS, PCOD, irregular periods. And certain drugs like antidepressants or blood thinners can also trigger telogen effluvium. So make sure you keep these terminologies in mind, okay? You cannot say you have androgenetic alopecia while you have alopecia areata, or you cannot say that you have androgenetic alopecia when you have diffuse thinning or telogen effluvium, right? So these terminologies cannot be interchanged because the treatments for all of these is different, and you have to treat every single thing differently and separate from each other. Now the last thing we're going to talk about is male pattern baldness. Obviously this is self-explanatory. Male pattern baldness can be just seen and you don't need to go to a doctor to diagnose it. Males start to see a receding hairline. They will either see an M or they will see a U, where they will start to lose hair all in the middle of the head. And this is because of high androgens in this body. When DHT is a type of androgen which converts on the head and then therefore causes follicle miniaturization, It starts to happen early in your 20s, it progresses in your 30s, and then you completely see baldness in your 50s and 60s. So if you are concerned about the hair, if you worry about your hair, because hair is personality, then you need to start intervention early in your 20s. It is very easily recognizable, and the only cause is DHT in males, and it happens in 7 stages. We can talk about that in another video. This video is specifically talking about what each conditions are and how they happen. So, to summarize, in females, female pattern baldness is when abnormal levels of androgen circulating in the blood, so therefore it is not because of androgen or DHT. Androgenetic alopecia in women is a genetically predetermined disorder due to an excessive response to androgens, which converts into DHT and causes hair loss on the head. Alopecia areata is when patches of hair loss happen on the face and the head, causing hair loss in men. If you have any questions or you need clarifications on these conditions, let me know in the comments down below. And I hope it has been clarified to you that these conditions are all different and they need to be treated differently based on your results. First, go ahead and get tested by a doctor. They will rule out what the reason is and then go ahead and start treatment.